With this video, we would like to summarize and demonstrate our recommendation for the rational use of PPE in healthcare setting for the care of suspected and confirmed COVID-19 cases. Before you start, please check that everything you need is available. Gown, 2 pair of gloves, respirator, face shield or goggles, biohazard bin, 2 containers, one for contaminated and one for clean items, hydroalcoholic solution. Keep in mind to check the integrity of every single PPE at every step of the donning. If you notice a lack of integrity, please dispose the PPE and take a new one. Remove all your unnecessary items such as rings, necklaces and watches. Before wearing the PPE, proper hand hygiene should be performed following international recommendation using alcohol-based solution. In case of healthcare personnel with long hair, make sure that hair is properly combed at the top of the head. The first PPE to be donned is the gown. This video presents a single-use, long-sleeved, water-resistant gown. Wear gloves. After wearing the gown and gloves, we suggest to proceed with the respirator that protects for the inhalation of droplets and particles. We suggest that FFP2 or FFP3 respirator be used for the procedures involving aerosolation. Otherwise, please use a surgical mask. Put on the goggles for eye protection. Place the goggle over the mask straps. Before proceeding into the patient room, please check that every single PPE is correctly worn. If available, ask to a second operator to check for you. Wearing the PPE correctly will protect the healthcare worker for contamination. After the patient has been examined, the removal of the PPE is a critical and important step that needs to be carefully carried out in order to avoid self-contamination, because the PPE could now be contaminated. The gown and gloves are removed first because they are considered a heavily contaminated items. Remove both at the same time as follow. Grab the gown for the shoulder, avoiding touching neck and other clean parts. Pull the gown energically away from you in order to unbutton the back side of the gown. Remember, the outside of the gown is contaminated, while the inside is not. Keeping this in mind, remove the gloves and the gown together, pitching both items by the wrist, as shown in the video. If you fail in removing them together, don't panic. Follow our beloved Christina, starting by pinching and holding the glove with the other gloved hand between the palm and wrist area, peeling the glove away from the wrist until it turns inside out, covering the fingers. Now that both ends are half gloved, remove the glove from one hand completely by grabbing the inside part of the glove and peeling it away from the hand. After this, hand hygiene should be performed and a new pair of gloves should be worn to further continue the dropping procedures. With the new pairs of gloves on, goggles should be removed and either disposed if they are single-use, or place it in the contaminated container for disinfection. Perform again hand hygiene. The respirator should be removed next. The last PPE item that should be removed is the second pair of gloves. To conclude, perform hand hygiene again.